In April, the University Health Professionals hosted the latest in a series of training sessions designed to help union members reduce workplace violence.
Shatter the Silence is a program that is designed to discuss workplace assault and violence. This particular session is going to be regarding healthcare sector and what and how and who are directly affected day to day in trying to do their jobs.
The Shatter the Silence series of conferences was initiated by ConnectiCOSH, the Connecticut Council on Occupational Safety and Health. Speakers included author Jane Lipscomb, AFT's Sarah Markle Elder, and ConnectiCOSH co-chair Steve Schrag. Dr. Lipscomb is the author of Not Part of the Job: How to Take a Stand Against Violence in the Work Setting, and delivered the event's keynote speech.
It's a great pleasure to be here this afternoon and be part of this grassroots movement with the unions and labor working on workplace violence in the state of Connecticut. Without further ado, please welcome Dr. Jane Lipscomb.
You can't really talk about this issue without addressing staffing. All the experts recognize that a highly risky situation is when you have staff that are working alone or out of the line of sight of someone else, and that often comes down to staffing. I mean, you can have adequate staffing and not be using them optimally, but often we hear complaints about there just isn't enough staffing, that they've got, 5 or 6 open positions on a unit, and they're using, per diem staff or floating individuals from another unit. It's essential that top management is committed to this, and that means not only issuing a zero tolerance policy, but putting resources into the program.
Sarah Markle Elder discussed the elements of a workplace violence prevention program and Connecticut's legal requirements for protecting workers in healthcare settings.
It requires the employers to maintain records. It requires an annual assessment of the records. So ideally, in the real world, I would say, at least quarterly would be better, but at least there's an annual requirement. And the law says that the employer must report the number of incidents and locations to the Connecticut Department of Health if the department demands it.
Steve Schrag rounded out the discussion with a focus on action we can take in our workplaces and legislative action we can take at the state and federal levels.
So what I'd like you to do is spend 4 or 5 minutes together as a group looking at that stuff and answering those 2 questions. What do you think of any of these things will have an impact on your workplace, and what ideas do you think we should be doing in terms of next steps?
What it does is just give them transparency, where all they have to do is submit a report to the Department of Public Health. And they're saying it's because it's cost. But how can they do a budget without a plan? They need a plan, and all we want to do is have them report it and put it up on the Department of Public Health website.
Reducing workplace violence takes a team. Get involved and get active.